Hi, good evening. Austin Mayor Steve Adler. Got a minute? We're going to go over the dashboards that we normally take a look at. Numbers came down a little bit today, still kind of flat. We're not seeing the increases that you can see in 32 states around the country. States that had low numbers like us, plateaued out like us, now are seeing numbers going up. That has the president and the CDC and nervous and talking about states taking action to stop that. We pulled up video last night and had the president's words. But let's take a look at our numbers so we can see those. Today's also Tuesday, so we'll go through the data dump that we get from Dr. Escott on every Tuesday. Always some interesting work that comes in that. But let's begin with the key indicators for the staging area. Here is that chart. You can see the number of new admissions, 15. That number is down from the 20 it was 7 days ago, which means the 7-day moving average dropped to 18. That's the lowest we've had in a while. It's been batting around between 19 and 22. It's good to see it go down to 18. Hopefully that'll continue. New cases today, 91, lower than the 7-day moving average. That's good. The positivity in our area has gone down to 4.3%. It's been at 4.4%, so not a big move downward. We really want this number to get south of 3%. Let's take a look at the other dashboard that we take a look at. This talks to us about the this talks to us about what we have, who we have in the hospitals. 141. That is down from the 7-day moving average of 151. People in the ICU, 46, down from the 7-day moving average of 55. Ventilators, 31, one down from the 7-day moving average. So these are all moving in the right direction. Deaths, 816, 4 people passed away in the last 24 hours. We were at 812. We still have one of the lowest mortality rates in the country. We're going to talk about that in a second. But even with that, 816 people pass away. If we had the same mortality rate, by the way, as the rest of the state or the federal government, this number would be well in excess of 1,600 and not just the 816 that we see here. Let's go ahead and take a look at Dr. Escott's and Director Hayden's numbers and charts for us. This is the presentation that they gave to the combined meeting of the City Council and Travis County Commissioners Court today. You can see that, let's see if we can move through this side. New confirmed cases, numbers went up, came down, been basically flat. This is what we need to drive this number down. This is the number that stayed flat for around the country until recently, and now it's starting to go back up in other states. Hopefully that won't happen to us. I'm nervous about the governor taking the mask mandate off and the message that sends. These are new admissions, hospital admissions. You can see that it's headed down. That's how we've gotten to the 18 number that we have here today. This chart, the blue is hospitalizations, orange is ICU, gray is ventilators. Numbers heading down, flattening out a little to the right. These are the University of Texas projections. You can see we've gotten down low. This is hospital admissions at 10. We would start seeing a number perhaps going down to risk level 2 on that color chart we saw before. It'll be going down to we're in the yellow now, it'll be going down to the blue if we can get to that place. And at the pace that we're going on right now, we get down to that 10 number toward the end of the second week in April. That's assuming we keep up the same kind of behaviors that we're looking at right now. This is looking at ICU patients, admissions, ICU patients, hospitalizations, and ICU patients. You know, I talked a second ago about the mortality rate in Austin compared to the state average. I said we were less than half. Federal average, less than half. These are the actual numbers here, looking at counties in the state of Texas. Travis County at 74.2, Bear, San Antonio at 164, Lubbock at 250, Harris County at 122, El Paso 301, Dallas 145. Those are the number of deaths per 100,000 people, and we're at 74.2. There are a lot of reasons that you would see that number. Some you might expect. Part of it is probably the policies we have and a willingness of the community to really wear masks and to quarantine and to show that level of discipline. But it's not just that. Here you have obesity prevalence in Austin, Travis County, which is the low line. You can see that compared to other cities, Austin's base health condition is better, so less vulnerable people in our population. Diabetes, same kind of story. This line here is Lubbock County, but right above that in diabetes, Austin. With the others higher. Yellow is Dallas. So we're just healthier. 65 and older, we're a younger population. You can see Travis County here, younger than the two right above us. That's Harris County and Dallas. Adults in fair or poor health condition, here at 15%. Again, Travis County lower than some of the others. Unemployment rate is lower in our city than in other cities because of lots of different kinds of factors, but there is a correlation between high unemployment rate and perhaps not the same access to health care and that kind of thing. But all those health issues, though, don't really fully explain this chart. And this is cumulative cases per 100,000. In Austin, because we're a healthier population, you would expect the people that catch the virus to perhaps have more dramatic issues or challenges in other cities because their base health is not as high as Austin. But here is just the number of cases. This is who gets cases. This is the actual just transmission of the virus. It's not due to the underlying health conditions in the same way that we talked about earlier. And you can see Travis County, cumulative cases per 100,000 lower than the other cities, significantly lower than you see here in Lubbock and El Paso, lower still, though, than what you can see in San Antonio and Lubbock, lower than what we see in Harris County. Again, just like our community stepped out during the winter storm to help one another, it's a community that is continuing to mask, continuing to require masking, continuing to isolate, continuing to do the things that are generally necessary. We just have to keep it up a little bit longer while we get everybody vaccinated. This is the chart that shows hospitalizations by age group. You can recall we used to have the hospitalizations, the four oldest age groups were the highest percentage in middle ages and then the younger folks. But what's happening is we have fewer and fewer cases in the older folks as they get more and more vaccinated. The percentage of hospitalizations that are older folks start coming down. And now it's pretty well mixed in with the middle age groups. The ones that are showing the real jumps here are 20 to 29, 40 to 49. And their percentage of vaccination is much lower than people over 65. These are the actual numbers that go with the charts that you just saw, hospitalizations by age. You can see used to be here 25-32 down to 19, 42-34, and that next age group down to 26, 50 and 22 down to 19. So that's just the numbers for that other chart. This is hospitalizations by race and by ethnicity. We had gotten down to 32.6 for Latino community, now up to 45% on this chart, but we also have a drop in the African American percentage from almost 13 down to just over 9. This is the percent hospitalizations. We are focusing right now, Austin Public Health and Travis County, on being the kind of the safety net for folks most vulnerable. And while we have more and more vaccines being given out by grocery stores and drug stores, and most of them going out that way, Austin Public Health, working with Travis County and with other partners, community care, really trying to focus on the vulnerable populations in our city, doing a lot, as we saw yesterday, mobile outreach to people that are homebound. There was a vaccination clinic in an East Side Catholic church for 1,500 people. So we're doing that kind of work. Here's hospitalizations by race and ethnicity, looking at the actual numbers. That increase in the Latino community reflected going from 46 to 67 people. Here's positivity by week. Remember, what too long ago, we were up here at 16.3 and worried about our ICUs, down to 4.3. Which is basically flat as it's been for the last several weeks. That's a number we need to drive down. This is positivity by race and ethnicity. You can see everybody coming down. You can see that almost everybody is below the 5% mark. We have Asian and the other. Barely the white, almost at 3%. Black or African American also down at 3%. This is the gray area, Hispanic Latino, which is above the 5%, which is the continued concern and why that's a priority focus. Here's positivity by age group. You can see positivity in vaccinated folks starting to go down here, the older folks, which means that the younger folks are going to represent a higher percentage. Those are the high school, middle school, elementary school, preschool positivity numbers. This is the number here, cases in our nursing homes and long-term care, 6 within the last 14 days, 16 within the last 28 days. That's down 98%, 98% down. Since the beginning of February. Again, we have more capacity than demand for infusion centers. If anybody gets the virus early in stage, I would check out and see if you're eligible for this. It's what the president got. It's what, if I got the virus, this is the first thing that I would be checking with my physician to see if I qualified to be able to do that. These are the flu numbers. Influenza, we're keeping low. At some point we need to calculate how many people, based on last year's numbers, would have died of the flu, based on last year's and the year before that, percentage of people that caught the flu, now down at 2%. Next flu season, we might want to wear masks as well, even if COVID isn't an issue with us. We should take a look and probably think about that. This is the stages. We're in the yellow area right now, 10 to 29. If we drop below 10, which at this pace we could hit, the end of the second week in April, we can drop down to this blue area, which increases the gathering sizes we can be at, increases the crowds that we can be around. Still, wear a mask. Still avoid large groups. Although the CDC has said that if you're vaccinated, it's okay now to be indoors with other people who have also been vaccinated. Austin Public Health, this is their dashboard. You can find it. What it'll show you is we're mid-20s with respect to race and ethnicity on vaccinations that are given in the city. We're going to be combining, this is just Austin Public Health. When you look at the dashboard, we're going to combine it with Travis County and with community care so we get a better feel for how we're doing. At this point, a total of 173,000 total vaccinations. That's first and second doses, 25,000 delivered last week. These are all Austin Public Health numbers. 11,000 school and child care staff. Senior population, 60 years and older. 30,000 people have gotten first and second doses. 23,000 people have just gotten the first dose. But total first doses, 53,000. Total second doses, 30,000. The state will say that in addition to just Austin Public Health, but in the community generally, we have over 80,000 of our residents over 65 that have been vaccinated. If you or anyone you know is 80 years and older and doesn't have a vaccine yet, we want to make it as easy for that person to get vaccinated as possible. They could just show up and get vaccinated. But if they want to have the paperwork done ahead of time, they just have to go to 311, provide their name and the phone number. Austin Public Health will call you back. Just leave that information with 311. You'll get a return call. You'll have an appointment set for you to go ahead and get that vaccine, and we'll get the paperwork done. If you tried to get on the system tonight at Austin Public Health, you found they couldn't. That's because they're doing an upgrade, IT upgrade tonight. The system will be back on tomorrow. Generally speaking, we're going to be giving appointments in Austin Public Health on Monday and Thursday nights for people to be able to sign up to get the vaccine. Austin Public Health is asking that if you went on the Austin Public Health site and signed up, registered, but then ended up getting your vaccination somewhere else, they're asking if you would go ahead and onto their system and take their name out. So they can just more and more rely on the people that are still there being people that need the vaccines. So it'd be great if you could do that. Let me close by talking about this upgrade. I think we'll be good after tonight. Hopefully, we'll have a new, more user-friendly design in place for that system. Again, you'll be able to take your name out if you pre-registered but have gotten your vaccines somewhere else. Most of the vaccines in the area are being given out by other parties. So centraltxvaccs.org/hubs is a good place to go to find a vaccine. It's the one that we've been showing to you on past days to take a look. It is still the same website to go to. There it is, to check out that site. And then finally today, county judge and I extended the eviction moratorium for another month. The federal government extended their eviction moratorium as well. We have rent 3 money for folks that need to catch up on back rent, although now not just tenants, but also landlords can also apply. We have one of the the lowest rates of evictions of any city in the country. I think that's contributed to the lower mortality rate that we have in the city. But we have to make sure that we don't have a flood of evictions when these rules come off, which is why we have the rent-free money. We're getting some more money from the federal government to also assist. So if you're a landlord and a tenant, if you're behind, or you're behind in your collections, make sure you go to the city website so that you can get relief. With that, I wish you all a good night and take care.